Hello. Today you will be learning about some evidence-based practice measures to prevent falls and improve safety. First, I would like to thank you for making fall prevention and resident safety a priority every day. By participating in this fall prevention education and implementing the recommended fall prevention interventions, you are demonstrating your commitment to resident safety. This training will examine falls and fall-related injuries and deaths among those 65 and older, as well as the factors that increase one's risk for falling, and explain the process of purposeful rounding. To first provide some background surrounding the issue, in 2020, there were approximately 55.8 million people in the United States aged 65 and above. This age group has grown 5 times faster than any previous generation, and by 2030 it is estimated that 1 in 5 individuals will be 65 and older. This rapid growth may be attributed to the large baby boomer population, life-saving and extending medical and technological advances, as well as disease prevention and health promotion initiatives. However, as the older population continues to grow, so do the rates of falls. Currently, falls are the highest risk for injury and death among this age group, and it is estimated that 1 in 4 seniors fall annually in the U.S. Falls among this cohort can result in adverse consequences for the individual, including a reduction in quality of life, an inability to function due to injury. These individuals may experience an increased fear of falling and restrict activities, which can compound issues of muscle weakness. They may suffer from severe injuries because of falls and potentially death. In 2018, 36 million individuals aged 65 and older reported falling, and 8 million of those resulted in an injury. These injuries incurred approximately 50 million in medical costs. The fall-related deaths among this cohort have also increased from 55.3 deaths per 100,000 in 2012 to 78 per 100,000 in 2021. Unfortunately, the occurrence of falls increases for the 1.6 million elders residing in nursing homes. Fall rates among nursing home residents are more than double those 65 and older living in a community setting, with an estimated 50 to 75% of nursing home residents falling with an average of 2.6 falls per resident every year. 10 to 20% of those falls result in serious injuries, with 1,800 deaths annually. So why are individuals 65 and older at an increased risk of falls? Well, falls are multifactorial in nature. That is to say, there are many reasons why one falls, and the reasons are classified into 3 distinct factors, namely internal or intrinsic, external or extrinsic, and situational. Internal or intrinsic factors are those occurring within an individual. They can include the effects of age on balance, gait, strength, acute medical conditions, chronic diseases, deconditioning from inactivity, behavioral symptoms, and unsafe behaviors, or medication side effects. External or extrinsic risk factors are those occurring outside of the individual, such as environmental hazards and unsafe equipment or personal care items. These may include poor lighting, cluttered living areas, uneven or wet floor surfaces, unstable furniture, unstable bed wheels, ineffective or unlocked wheelchair brakes, missing equipment parts, improper footwear, difficult to manage clothing, or the inability to access personal items. Situational factors within a facility can include those newly admitted residents, recent room changes, or perhaps a new roommate. However, despite the cause of falls, experts agree that falls are not a normal part of aging and can be prevented. That brings us to purposeful rounding. Purposeful rounding is an effective intervention that has proven to help reduce falls in both acute and long-term care settings. Purposeful rounding, sometimes referred to as intentional or even hourly rounding, is a proactive intervention that helps nursing staff to anticipate and address residents' needs by utilizing a checklist intended to promote a clean, comfortable, and safe environment. In other words, rather than merely performing a quick visual check, staff are very mindful in their approach and proactively address the residents' needs, thereby eliminating many of the factors that could increase the risk for falls. Purposeful rounding is not a new concept. Originating in the United States, this practice began in acute care settings. However, there is a growing body of research and literature to support this practice in the long-term care setting. Some of the benefits to purposeful rounding include the reduction of falls. This may be attributed to the caregivers proactively meeting the residents' needs. This could be especially helpful for resident populations that suffer cognitive impairment, such as dementia. These individuals may not remember to call for assistance. However, if the individual's needs are met routinely, they may be less compelled to get up unassisted. Another benefit is the decreased risk for pressure ulcers. This comes to no surprise as individuals who have compromised mobility are repositioned regularly should develop fewer pressure ulcers. Research surrounding purposeful rounding also has shown a decrease in call bell usage. This would be an expected outcome if needs are being met proactively or before the individual needs to call for assistance, there will be less call lights. And finally, improved resident, family, and staff satisfaction. Since needs are being met proactively, care is less likely to be delayed. Additionally, since care is bundled, staff is less likely to be chasing call bells. Although the duration of time between rounding can vary according to facility preferences, time of day, and patient acuity, it generally occurs 1 to 2 hours. However, the duration could be shortened to 30 minutes for those identified at high risk for falling. As previously mentioned, purposeful rounding includes a checklist. One of the most common checklists utilized is the 4Ps. The 4Ps is a mnemonic device uh, used to help nursing staff remember what they should check for while performing purposeful rounding. It includes the evaluation of pain. CNA should ask the resident if they're having pain or observe for any signs of discomfort. Any reports or signs of discomfort, anxiety, or agitation should be relayed to the charge nurse. The charge nurse can then further evaluate and treat accordingly, whether it be to medicate the resident or to report their findings to the primary care provider. Next is positioning to ensure that the resident is in a safe location and properly positioned. Take note of any abnormal posture while sitting in a chair, or perhaps there's an extremity hanging off the edge of the bed. The resident should be repositioned accordingly as scheduled and or needed. Check to ensure that the bed, walker, and or wheelchair is locked as appropriate. The third P is to evaluate personal hygiene or potty needs as scheduled or required. Again, an ounce of prevention is worth a pound of cure. It is better to ask the resident while rounding if they need the bedpan or toilet rather they attempt to get up unassisted and have a fall. You typically wouldn't wake an individual to ask them um, unless they were on if they were on a toileting or incontinence care schedule. But if they're awake, we can certainly offer. And finally, to ensure that all personal needs or desired possessions are within the resident's reach, call bell, telephone, water pitcher, mobility device as appropriate and care planned. Although indirect caregivers do not provide hands on care, many of these actions are within their scope as well. Even if they could not provide the required care, they should report their observations to a CNA or a charge nurse. The four P's of reducing the risk of falling document is courtesy of the Health Quality Innovation Network. It is a tool to remind nursing staff of what to observe while performing purposeful rounding and offers suggestions for addressing the four P's and possible scripting for nursing staff. This document has been posted on all units as a reference for staff. Sometimes staff members may find it helpful to have some kind of scripting available, and here are their suggestions. First, you should introduce yourself. This is especially important for newly admitted residents or those who may forget where they are or who you are. Next, evaluate for pain or discomfort and ask such questions as, are you in pain or how are you feeling? Then ask, are you comfortable, and observe where the resident is positioned. Are they slouching in their wheelchair or are their extremities hanging off the bed? To evaluate for personal hygiene, ask, do you need to use the bathroom or bedpan? If the resident is incontinent, are they wet or soiled? Concerning personal needs, ask, can I get you anything? Do you have everything you need? And be observant of their call bell, water pitcher, phone, etc. Finally, if appropriate, tell the resident when you will be returning and remind them to use their call bell if they need anything before your scheduled return. In addition to the four P's, it is important to perform an environmental scan and be mindful of any potential fall hazards. For example, is the bed at a low appropriate height and are the wheels locked as appropriate? Are side rails positioned as ordered and care planned? Concerning assistive mobility devices, are the wheels locked as appropriate and indicated and within reach of the resident as care planned? Is lighting adequate and functional? Are the cords secured? Are there any trip hazards present? And is the floor clear and dry? It may be necessary to alert the charge nurse and/or maintenance of any hazardous findings, but the resident's immediate safety should always come first. To help with the implementation of this intervention, flow sheets have been created for both Q30 and hourly checks. However, even individuals who are not on scheduled checks would benefit from purposeful rounding, evaluation of the four Ps, as well as checking for any environmental hazards routinely. Reminders for the four Ps, purposeful rounding and environmental scanning, and potential scripting have been made available to nursing staff. As healthcare professionals, it is imperative that we provide the highest quality of care to those we serve. In long-term care settings, it has been identified that the older population is at a high risk for falls and fall-related injuries and deaths. We know that falls are multifactorial in nature, but can be prevented, and despite the many fall prevention initiatives, there's always room for improvement. Purposeful rounding has proved to be an effective intervention to fall prevention. However, for this intervention to be successful, staff must be committed to implementing and sustaining it. Thank you for your time and attention. Together, we can successfully promote safety and prevent falls within this facility.